Developmentally appropriate characteristics of an 8-year-old include the ability to attend to short tasks, stay seated during teacher instruction, and play cooperatively. Assistive technology must be provided by the school district when it is necessary for a student's appropriate education. A student with an emotional behavioral disability is enrolled in a general education classroom with consultative services. Behavior difficulties are escalating and interfering with the student's learning as well as the learning of others. Another placement is being considered to better meet the student's needs. Choose the next least restrictive placement. Part-time ESE classroom. A school psychologist has reviewed a student's evaluation data with the student's parents and the rest of the staffing committee. The committee has recommended that the student age 13 is eligible for the program for students with emotional or behavioral disabilities. After the committee writes the goals for the student, what is the next step? Selecting the least restrictive environment for the student. Factors to consider while preparing the annual goals of a student's IEP include the severity of the student's disability, attention skills, and special abilities. Consultative services provided by an ESE teacher include maintaining communication with general education teachers. While attending a parent conference, a new ESE teacher explains that a basic classroom expectation is for the students in the class to function academically at approximately half the rate of an average children. A more experienced ESE teacher serving as the meeting chairperson waits until after the meeting to comment to the new teacher. What comment should the more experienced teacher make? It is unwise to give parents rules that, when applied, may lead to have lower than rather higher expectations of the children. The findings in Diana v. State Board of Education, California, were significant in that they changed procedures for identifying and placing students in special classes. Free and appropriate public education for individuals with disabilities was in part the result of which court case? Park v. Commonwealth of Pennsylvania. A student has received Tier 2 interventions for some time but shows no change in academic progress. Which of the following steps is next? Multi-tiered system of support committee meeting to determine if more intensive services may be needed. Which of the following behaviors is developmentally characteristic for a 5th grade student without disabilities? Reluctant to do homework. A student tells her special education teacher that she is thinking of committing suicide. The teacher should follow the school board procedures. Each student with disabilities currently placed in ESE programs must have an IEP review every 12 months. Sean is a 7-year-old with severe spastic cerebral palsy and a mild intellectual disability. He also has a gastrostomy tube for feedings. He receives most of his instruction in a general education classroom and has difficulty with concept formation, learning daily skills, and accessing material. Which professionals would most appropriately support Sean in his general education class? ESE teacher, physical therapist, and nurse. Parents of a student in the ESE program have started making frequent announced visits to the classroom, often interrupting the daily routine. An appropriate action for the ESE teacher to take would be to inform the parents that visits are welcome but must be pre-arranged. While addressing the needs of a student who uses a wheelchair for mobility requires toileting support, which of the following would be an appropriate resource? A paraprofessional. The Center for Autism and Related Disorders is most likely to assist with which of the following? In-home support for behavior and routines. Which of the following is most likely factor that associated with the disappropriate representation of diverse students in ESE? Systemic school bias. Which of the following yields a work sample analysis? A teacher examines a mathematics assignment to identify types of errors made in computation. In terms of diagnostic testing for initial placement in ESE, the Individuals with Disability Education Improvement Act requires that the assessment is conducted by a multidisciplinary team or a group of specialists. A 5th grade student in ESE with an emotional or behavioral disability scored at the 10th percentile in reading recognition on an individually administered diagnostics reading test. What can be concluded from this information? The student's score in reading recognition is below average for a student in 5th grade. An ESE teacher taught a 5th grade ESE class a social skills unit on acceptable classroom behavior. Which of the following is the most appropriate way to document skill maintenance in the student's general education classroom? The students maintain a log documenting their use of each new skill. A teacher has been informed that a student with cerebral palsy will be attending the class. The teacher conducts an assessment of the classroom to make sure that the student has access to all areas. Which of the following types of assessments has the teacher conducted? Ecological assessment. A 5th grade student has a specific learning disability in written expression. One of the student's IEP goals is to increase the accuracy of spelling grade level words by 80%. The ESE teacher would like to monitor the effectiveness of the individualized instructional strategies used to address this goal. Which of the following assessment methods would be most effective for the purpose? Administering curriculum-based spelling probes to the student and graphing the results. A teacher administers a Dibbles assessment to an entire class of 3rd grade students. This is an example of progress monitoring. An English language learner has been referred for testing to determine whether reading problems experienced in class are the result of a learning disability. To make such a determination, the student evaluation must include a variety of assessment instruments. Okay. Lynn disrupts her reading class by making noises, teasing other classmates, and dropping her pencils. The behavior can effectively be documented by using the Achenbach Child Behavior Checklist. A student with medical complexity may be exempt from participating in statewide standardized assessment. The maximum exemption that a student can receive is a permanent exemption. Oh. Which of the following would be considered a curriculum-based assessment? Individual portfolio. An ESE teacher wants to measure both the procedure and the product associated with students' learning of a given objective. Which of the following is the most effective technique to use? Performance-based assessment. A teacher collects prizes, composition, homework, assignments, and daily journal entries to determine student strengths and weaknesses in the language arts. This is known as portfolio assessment. Which of the following would be the most effective data collection method when collecting data on the percentage of time a student is exhibiting on a task behavior? Duration. A review of a student's record reveals the following scores from a norm reference test over the past 3 years. Based on these assessment results, which content area should the teacher focus instruction on first? Language. In reviewing the curriculum records for a new student in the middle school ESE program, an ESE teacher notices that the student functions at a 5.5 level in mathematics and a 5.0 level in reading. The other students in the teacher's class function at a lower level. What would be the teacher's first step in meeting the student's current needs? Performing diagnostic teaching to determine the appropriate instruction for the student. Having a classmate of similar background and gender assist a student with learning disabilities in solving both social and academic problems is an example of peer tutoring.